So, hi everybody. I'm Echo, and I'm with the Grand Rapids Red Project. Is everybody here familiar with our services and the services that we provide? Some people? Okay. Oh, you guys are great. We address four major health issues. So, HIV, hepatitis C, substance use disorder, and overdose. I am a recovery coach with the Grand Rapids Red Project. And so we deal with a lot of the hepatitis C cases because we don't have the federal funding for case management and EIS like we do with the HIV. Our recovery coaches tend to get the hepatitis C cases. And so we help people through um, treatment, getting access to treatment and through treatment. So that's what I'm here to talk about today is kind of the recovery process and how that relates to hepatitis C. So usually there is some motivating factors that get people thinking about recovery, right? So it can be anything. It can be internal or external. But our little ball is unhappy, right? Because typically they're not positive motivators, right? Life isn't usually just going really great, and people just start to consider recovery. Usually it's not positive. But usually there are some sort of motivating factors. Um, and that's when people kind of move into these stages of change, right? At the Red Project, I get people in all different stages of change. And we have to be able to kind of move fluidly through the stages of change because it's not necessarily like a 1, 2, 3, 4, 5 step process and it goes in sequence and in order. So we have to kind of move fluidly through these different stages of change because people will, move through the stages of change and kind of zigzag. Um, yeah. So there are many different definitions of recovery. At the Red Project, we use a harm reduction philosophy. The Chicago Recovery Alliance defines recovery as any positive change. So, that can look to different individuals differently. So whether it's safer using strategies or just using less, whatever that means, we really try to meet people where they're at and let them define recovery for themselves. So there's also the abstinence-based recovery. So just abstaining completely from using substances, or there is the medically assisted treatment. So a person can get medications that will help them in their recovery, whether it's Vivitrol, Suboxone, methadone, things like that. But there are um, many different paths to recovery. And so this is kind of where some challenges can come, right? Because we talked about those different motivating factors. And oftentimes, those motivating factors don't line up with what a person's personal goals are, right? So, say it's the law, or maybe it's a family member, or, whatever the case may be, trying to motivate a person into recovery. So now maybe that person's goals and the person going into recovery don't line up exactly, right? So we talked about like those stages of change. And that is when people can suffer um, really negative health outcomes, right? Because they could be denied treatment for things like hepatitis C or even something like methadone. Um, so that's when people suffer these negative health outcomes. Um, so there was a study done in 2017, and what it says is many medical programs require individuals to abstain from use for a specified time frame prior to starting treatment. Others require individuals to submit to screening or attest to maintaining abstinence during treatment, or require providers to counsel patients on substance use, and in some cases, refer active users to treatment. These common restrictions on care undermine the recommendations of the AASLD and the ISDA that are widely recognized as a standard of care. Current research shows that people who inject drugs achieve similar cure rates, so sustained biologic response as compared to patients who do not use drugs. Additionally, injection drug use is the foremost driving factor in the perpetuation of the HCV epidemic within the United States. Um, as the AASLD ISDA guidelines notes, testing and linkage to care combined with the treatment of HCV infection with interferon-free regimens has the potential to dramatically decrease HCV incidence and prevalence. Postponing access to care for people who use substances or otherwise do not maintain sobriety not only allows the health of these individuals to deteriorate, but also undermines public health efforts to end the HCV epidemic. So this is where, the barriers to treatment kind of come into play. Because like we had talked about, recovery can mean different things to different people. And so if a person's goals aren't aligning with, the outside entities' goals of, complete abstinence or, whatever the requirements may be, people are, and, like Larry shared, people are literally being denied care. So I like to kind of compare it to some other health issues that we deal with, like say diabetes. So if a person is living with diabetes, typically their healthcare providers will really support them and offer them, a range of options to deal with, with their healthcare. So they may get a nutrition specialist. They're going to be given a nutrition plan, and really get surrounded with support for this. But yet, with somebody living with diabetes, if they are, say, go off of their diet or, have a cupcake, we don't then deny them treatment for the diabetes. We don't then deny them insulin for their diabetes. So it's odd to me that substance use is looked at any differently than that. So because people are literally being denied care because they are experiencing symptoms of their disease, right? So if somebody is using a substance, they're being denied care for hepatitis C or, even methadone. So yeah. I'm really glad too that Larry talked a lot about the stigmas that are involved, especially the stigmas that we see in healthcare, because that I would say is another barrier to people accessing HCV treatment. Because, like Larry said, as soon as we walk through those doors, there are assumptions being made about us, and we are definitely treated a certain way. And I think, specifically when seeking treatment for hepatitis C, there are many stigmas that come along with that. Long before, we even walk through the door, there are just assumptions made about us. There are stigmas attached. So I'm really glad that Larry touched on that because I think that is another barrier to people wanting to access HCV treatment for fear of the way that they're going to be treated, fear of the way that they're going to be looked at. Again, fear of people finding out and how that may affect them in the community. So, yeah, that's all I've got. Does anybody have any questions? No? Yeah.
So I'm wondering how easy or how difficult it is in your personal work at getting people in to see a provider for treatment, even if they don't necessarily get the treatment immediately. Are you able to find them a specialist that they can see for hepatitis C management?
On paper, it is a pretty simple process. So a person initially gets a reactive hepatitis C test. So then we connect them to a primary care physician who then does further testing to, get a sure reactive result. And then we connect them to the hepatitis C clinic. And I will say our hepatitis C clinic is great. So that's amazing. Um, Putting that into practical everyday um, practice is a little more difficult. So a lot of our participants do not have insurance. So then, in order to, because they have to have a primary care before they can get referred, and they have to be referred by a primary care to get into the hepatitis C clinic. So I can't just refer. I can't just bring somebody and say, hey, this is what's going on. They have to be referred by a primary care. So if they don't have insurance, then there's the barrier of, securing health insurance and then finding a primary care. And unfortunately, in the area that I'm from, a lot of our low income Medicaid accepting primary care physicians have quite a long, a full schedule. So then, we're waiting to get into an appointment. And of course, you have to do the first initial orientation appointment before you actually get seen, and so a lot of my participants deal with other issues such as, not having a vehicle, being homeless, or not even just being homeless, but moving around frequently, not having a cell phone, um, just not being, able to keep up with all the appointments. So in theory, it's a really simple process, right? You just go see your doctor refers you, and then you're in the clinic, right? Perfect. So, but when it comes to real life, it's a little more difficult than that. There are other barriers that people are facing. So whether it's transportation, housing, um, cell phone, whatever the case may be, it tends to not be as easy as you would think it would be. So I hope did I answer that well? Yeah. So yeah, no problem. Any other questions?